Before we start, quick heads up. If you've already fixed your diet, cut out the obvious trigger foods, and your GERD still isn't improving, do not click away. Stay until the end of this video for two things. First, I'm going to give you a free evidence-based GERD symptom observation guide that you can download, and I'm going to give you a practical way to understand what's actually driving your reflux so you can stop guessing and have a more productive conversation with your doctor. Second, this is the bonus. I'm going to share my own GERD story and why understanding what was actually driving my symptoms changed everything for me. That's the payoff. That's why staying matters. Now, let's talk reflux. You cut spicy food, you cut coffee, you cut chocolate. At this point, your diet looks like it was approved by a risk management committee that has never experienced joy. And yet, your GERD is still very much alive, thriving, and completely unimpressed by your sacrifices, which feels unfair, honestly. It's a little like carefully training a dog, buying the fancy treats, following all the rules, and it still chews your shoes the second you turn your back. You did your part. The problem just isn't that simple. So today, we're answering a question that I hear constantly. Why doesn't GERD improve even after you fix your diet? And no, the answer is not try harder. It's definitely not eliminate one more food until you're left with rice, water, and resentment. Before we go any further, a quick important note. This video is for educational purposes only and does not provide medical advice, diagnosis, or treatment. Always talk with a qualified healthcare professional before making changes to medications or managing symptoms. I'm Marcus, a research scientist, your wellness watchdog, and you're watching Health Sense or Nonsense. I really care about your well-being, and the entire goal of this channel is to help us make better health decisions together using evidence, not fear. If you Googled GERD diet late at night while sitting upright in bed, surrounded by pillows like a poorly engineered recliner, welcome. You are exactly who this video is for. GERD has a special talent for making people feel like they're failing at food. You'll hear things like, you must be cheating, or you're not strict enough, or have you tried eliminating just one more thing? And to be fair, diet can matter. Certain foods do worsen reflux in some people. That part is real. But here's the part that doesn't get said enough and is backed by decades of research, clinical guidelines, and real-world patient data. Diet changes alone often do not resolve GERD. That's not pessimism. That's just the evidence. And when diet doesn't work, people escalate. They restrict more, chase supplements, and try advice that starts with, my cousin swears by this, and ends with heartburn and disappointment. So today, we're clearing this up. No TikTok medicine, no fear-based food shaming, just conservative, evidence-based explanations with a little humor so we all don't lose our minds. Now let's talk about the myth that causes the most damage. The myth is simple. If you just avoid the right foods, your reflux will go away. It sounds so logical. It feels productive, and it's incomplete. Large systematic reviews and clinical guidelines consistently show that there is no single GERD diet that works for everyone. Trigger foods vary widely between individuals. Many people follow what looks like a perfect diet on paper and still have symptoms. That tells us something really important. Food is often a modifier of symptoms, not the root cause. When food isn't the root cause, people get stuck. They rotate diets, blame themselves, and assume they lack discipline. Meanwhile, the actual driver of the symptoms stays untouched. So, here's the real question, and this is where most reflux advice stops. If food isn't fixing your GERD, what actually is? The answer is rarely one thing. It's usually a combination of mechanisms. And once you understand those mechanisms, you stop chasing fixes and start targeting causes. The first and most important concept is this. GERD is not primarily an acid problem. Most people with GERD produce normal amounts of stomach acid. The problem is where that acid goes. GERD is fundamentally a barrier failure problem centered on the lower esophageal sphincter, or LES. That valve is supposed to stay closed most of the time, open briefly when you swallow, and then close again. It is not supposed to relax whenever it feels like it. When the LES relaxes too often or at the wrong time, reflux happens regardless of how clean your diet is. You can eat the safest food on earth and still reflux if the valve isn't doing its job. No amount of spinach repairs a faulty valve. That's not a willpower issue, that's straight anatomy. The second reason why diet often fails is because trigger foods are unreliable by design. Chocolate, coffee, citrus, and fatty meals can worsen symptoms in some people and do nothing in others. They also get blamed for more often than the evidence supports. Reviews consistently show weak evidence for universal food elimination and massive individual variability. Two people eat the same meal. One is fine, the other regrets everything. Same food, different physiology. This is why endless elimination rarely works long term. Before we go any further, I want to pause for 1 second, because this is a point where most people either click away or finally get unstuck. If diet hasn't fixed your GERD, the next step is not more restriction. In the next few minutes, I'm going to show you how to tell whether your reflux is being driven by mechanics, sensitivity, or timing. And to remember, I'm still going to come back to my own experience at the end because that's where all of this clicks. If this video is already helping you make sense of reflux without panic or pseudoscience, take a second to like and subscribe. It helps this channel reach people who are tired of being told to fix mechanical problems with vibes or hype. Now, let's talk about esophageal hypersensitivity, because this is where a lot of mystery GERD lives. Some people with reflux have normal acid exposure, but increased sensitivity to that exposure. In plain English, the reflux isn't objectively worse. The signal is just louder. Stress, anxiety, poor sleep, and prior inflammation can lower pain thresholds in the esophagus. This explains why stress flares GERD and why symptoms persist even when acid is controlled. This is not all in your head. It's how the nervous system processes threat. Another underappreciated factor is timing. One of the strongest predictors of reflux isn't what you eat, but when you eat. Studies consistently show that late meals increase reflux and lying down too soon worsen symptoms. Large evening meals also increase acid exposure. You can eat safe foods and still reflux if portions are large, meals are late, and gravity is ignored. This advice is boring, which is exactly why it works. Medications matter too. Some medications quietly worsen reflux by reducing LES tone, delaying gastric emptying, or increasing esophageal sensitivity. This includes certain pain medications, some antidepressants, and even some common supplements like iron or calcium. This does not mean stop your meds. It means reflux sometimes persists because something changed and no one connected the dots. At this point, you might be thinking, okay, this explains a lot, but what do I actually do with this information? That's a fair question. Here's where we slow down and get practical. One of the biggest mistakes people make with GERD is assuming that if something doesn't work immediately, it must not matter. But physiology doesn't work on internet timelines. GERD is rarely caused by one dramatic trigger. It's usually the result of small repeated stressors adding up over time. Late meals plus poor sleep plus stress plus posture is very different from one bad food. This is why the GERD Symptom Observation Guide focuses on patterns instead of prescriptions. Consistency matters more than intensity. Observation matters more than restriction. The guide is meant to be used as a short-term observation tool, not a decision-making tool. You're not using it to change medications, stop treatments, or manage GERD on your own. You're using it to organize symptoms and share them with a healthcare professional, because better information leads to better care. One more important thing that's worth saying here, because this is where people often get confused. When people hear track your symptoms, they sometimes assume this means micromanaging their body like a spreadsheet with anxiety. This is not the goal. This is not about documenting every burp, twinge, or suspicious gurgle like preparing evidence for a court case against your stomach. The goal is signal, not noise. Doctors don't need a 47-page novel about how you felt every hour on Tuesday. They need a short, structured snapshot that shows patterns clearly enough to guide next steps. That's why this guide is intentionally limited to a short window. 3 to 7 days is usually enough to reveal whether timing, posture, stress, or meal size is consistently involved. Anything longer often just creates fatigue, frustration, and hypervigilance, which can make symptoms feel worse even when nothing new is happening. Your nervous system does not need a true crime podcast about your esophagus. This approach also helps prevent a very common trap, confusing coincidence with causation. If you change 5 things at once and feel better, congratulations, but you've learned absolutely nothing. You don't know which change matter, and now you're stuck maintaining all of them forever. Clinicians don't think that way. They think in patterns. They're not asking what was the worst symptom. They're asking what repeats, what doesn't, and under what conditions. That distinction matters. This process can also protect you from unnecessary restriction. Many people discover they've been avoiding foods that were innocent bystanders the entire time. And sometimes this kind of observation reveals something even more important, that reflux might not be the main driver anymore. That's not failure, that's clarity. And clarity beats control every single time. Now, here's the part I promised, my own experience. In my case, diet did play a role. I ate acidic foods. My GERD was worse. But what mattered just as much, honestly, maybe even more, was timing and posture. If I ate late at night and went to sleep shortly after, it didn't matter what I ate. My stomach would be on fire. Once I started eating earlier and not lying down soon after meals, most of my GERD symptoms nearly disappeared. That experience is exactly why this video exists. Not to tell you what will work for you, but to help you figure out what actually matters in your case. When people use the guide consistently, patterns usually emerge. Late meal clustering suggests timing is a driver. Stress link flare suggests hypersensitivity. Persistent symptoms, regardless of behavior, suggest structural contributors. This doesn't replace a doctor. It makes seeing one far more productive. Before we wrap up, one more important reminder. This video and the GERD Symptom Observation Guide are for educational purposes only and are not medical advice. They do not diagnose, treat, or replace care from a licensed medical professional. GERD management should always be individualized with a qualified healthcare professional. So here's the bottom line. GERD that doesn't improve after diet changes isn't stubborn, it's misunderstood. Food matters, but it's rarely the whole story. If you want the free GERD Symptom Observation Guide, it's linked in the description below and pinned comment. Use it as a discussion aid with your doctor. I'm Marcus, research scientist and your wellness watchdog, and this has been Health Sense or Nonsense. Stay curious and ask the right questions. Wellness Watchdog out.